Thank you, Sashi. I'm
So,
impressed with what you have done. I'm deeply impressed.
so thank you. And I think we are meeting after 2 years from the Nutrition Network Practice Certification, which we did. And it was a
Yes.
interaction. I could always remember the kind of knowledge you shared with us. And I thought that whenever we get an opportunity that we do something on the addiction, I'll call you immediately. And you are one of the initial names which came to my head and immediately got you in.
Thank
So
you very much. I
I'll start.
must say to Mandar, I must tell him that I love to use his metaphor about the GPS in my coming book. So
Great.
I'll
Thank
ask him about that with his name, of course.
I'll connect you to him. And so I'll just start with introduction. I'm Shashi Shashikant Iyengar, a certified metabolic health coach from DLab.in, India's first and only award-winning platform. So founded in 2014 by Anup Singh, who is from IIT Roorkee and a silver medalist, and also Icons of India awardee. DLab pioneered the low carb movement in India. Anup's groundbreaking 100 grams carbs per day max protocol, which he developed in 2012, made LCHF and type 2 diabetes management possible in India, especially with the vegetarians. In 2020, he launched the DLife certification course, the only government of India approved program for the world's largest 144 CPD hours. So Anup Singh and I, needless to say, that we organized the India's historic metabolic health conference, MHC 1 and 2, and now in this year, MHC 3.
Wow.
So I'm going to introduce Bitten in detail. So Bitten Jonsson, a registered nurse since 1973, is an addiction specialist and sugar addict certified, is a forerunner in the field in Sweden, an international lecturer, and has been on TV and radio, given live lectures internationally, including UK, the US, and numerous times. Bitten is trained in the US and has developed a special treatment method involving integrated functional medicine and orthomolecular medicine together with American addiction specialist support group and developed traditional medicines. Bitten Johnson has written 3 books about sugar addictions. The Sugar Bomb in Your Brain, her first book was published in 2004, revised in 2010 and 2016, and is currently being edited in English. The book has very well received and has been published in Norway, Denmark, Finland, and Germany. She has further developed sugar. So when I say sugar, it is sugar with a registered trademark, Sugar R, a diagnostic instrument for sugar food addiction. Bitten Johnson was a member of NAATP, and also she was on the board of director of Food Addiction Institute 28 to 2022. She is also a support member of ASAM and Nutrition Network practitioner. Since 2012, she's training and certifying the next gen of sugar addiction specialist. Bitten has trained more than 200 experts from US, Europe, Australia, Canada, New Zealand, Brazil, and much more. She has treated more than 6,500 people since the start from 1992. She has had workshops and summits in the UK and US, among other places. She was one of the first or the very initial person globally who has recognized sugar addiction. So I think this is something which now we are talking, but she was a visionary who has recognized this addiction that time. So Bitten, again, I'm welcome you to this India's Metabolic Health.
Thank you. Wow, I'm very pleased, very honored.
So can you share your journey in addressing addiction, particularly food and sugar addiction?
Absolutely. I'm very prepared. Is it okay if I share some slides?
Please do.
Do I have
You have the
oh,
sharing.
I do. Okay, I got it. There we go. And because they can be a background, when I talk. I based my answers on your questions, which those are excellent. First of all, addiction to me, I'm not only working with sugar addiction, I'm trained in addiction as one illness, many outlets. So I work with alcoholics and pill addicts and drug addicts and, all kinds of addictions, process addictions, and so forth. So it's important to know. And I like to share this picture, which I teach my clients when I talk about my own history. When I was 4 or 5 years old, I loved sugar, not so much flour products like bread and flour is sugar molecules holding hands. I quote Dr. Unwin in UK. He has a lovely explanation on that. But I love chocolate and ice cream. But I didn't have any problems because I grew up in a family where my mom cooked food all the time, real food. So, but those times when I could get hold of some chocolate and ice cream, I didn't want to stop eating. In my teens, you know how teens are, we start comparing bodies, and most of us think that we're fat when we're not. It's like a obsession to talk diets and all that. And I think that is really causing, oops, I was too fast there. Sorry. That is causing starting to play havoc with the metabolic chain. But when at that time, nobody knew about that. Nobody talked about that. So we started dieting, we started through the week or eating only, one egg a day or something stupid or an apple or something. And many of us tried to really starve ourselves. And some people went into anorexia. I never did. I was a lousy anorectic. I could never, starve for a day even. And most people can't. Then when you starve, when your body finally gets food, you start binging. And you get terrified and think, now I'm going to, gain weight and I'm going to be even fat. I was never really fat at all, and I look at pictures and that was not the case. So when we binge, we start purging. And purging is not only vomiting. It's important to understand that. It can be heavy exercising, laxatives, all kinds of ways, fasting, another diet to try to get rid of the binging. But as you can understand, this plays a tremendous havoc with your body and the biochemistry and malnutrition in the brain and, increased insulin, volatile blood sugar. And I went through all that. But, at the same time, I came from a family where we ate the good food. So I didn't have too much consequences. During my teenage year, I could wake up in the mornings and feeling depressed or moody, or I didn't want to go to school. And I know today that was withdrawal. It was a hangover. It wasn't a depression at all, but at that time people thought, it was a teenage depression. Not at all. And I think many teenagers have that problem, that they eat junk food in the evening and in the morning they don't want to go up, get out of bed, they don't want to go to school and so forth. But this craziness keeps going. And the older you get, the less the body can handle trying to restrict, and you feel sicker than ever from the binges because they increase in size and frequency, and you start getting rid of it. So, this is a real vicious circle. And many end up being overeaters or volume addicts, as I call them, because now you have ruined, the body's hormonal system. And you also have depleted your body and stomach of oxytocin, which is a very important neurotransmitter when it comes to satiety and calmness. So I did pretty much all of this, not to a big extent, but I can recognize myself. And today's society, we have different names on these different stages, which is very sad because nobody dare look at the addiction that developed early underlying it all. So you have so many experts calling this so many names with so many crazy treatment methods that it's absolutely wild in my field. To me, this is sugar addiction. It's a psychoactive substance addiction. So I like to challenge you guys. I mean, we say food addiction. I'm not very fond of that word because I want to keep the word food for real food. So what is it we're addicted to? What it is sugar and carbs. It would be very stupid to call alcoholism a fluid addiction or a liquid addiction. Nobody would do that. Water is not addictive, but soda and alcohol is. So I think we have to go back to understanding what a psychoactive substance is, and we need to stick to that. That's what we're talking about, because that's what creates addiction and plays havoc in our brain. I'm sorry if I talk too much. You had questions for me.
I think, see, you can just go ahead and ask, go ahead and relate your slides. That is all okay, no problem. So what I wanted to know was what really led you to identify this sugar addiction? I mean,
Well, when I was 19 years old in nursing school, I started drinking, and I loved drinking as much as chocolate. So I developed an alcohol addiction. And for many years, being a nurse, I tried to control it. You can never control an addiction, that's an illusion. So whenever I drank, I got negative consequences. And the thing was that the key thing with addiction is hiding, lying, sneaking and loss of control. That's the key word to remember. If you don't want to do it or you try to control it and you can't, you drink more, eat more, take more pills, whatever you do, that you lose control when you get the substance in your brain, off you go. That's an addiction. And now, today, I was fortunate getting my treatment in US, in California, in a top-notch treatment facility. And during my treatment, they sent me to University of Irvine, where the new researchers were doing research on the dopamine system. So I got all that biochemical explanation 1985 in my treatment. And I've been sober since due to the fact that I got that knowledge. So, to me, it wasn't the slightest strange to just transfer what I know about alcoholism and drugs into sugar. It's the same illness. There's one problem, and you ask a very good question in the papers I got from you. What is different between alcoholism and drug addiction? I tell you what, first of all, it's the early exposure. If you look at this picture, it shows that, a 5-year-old, oh, my mouse is too sensitive. A 5-year-old does not have the prefrontal cortex developed. We know that from science. Okay, what does the prefrontal cortex do? That's where your personality is, that logic thinking, self-discipline, strategic thinking. You have all those things that will mature. Teenagers aren't pretty much into those things. So that has to mature when you're a teenager. But if you stop that development, something very bad going to happen. This is a picture of your brain when you see the blue things is the prefrontal cortex starting to develop. And when I started my training many years ago, they said that prefrontal cortex is not developed until you're about 20. The strange thing, Shasi, is that some years later, they said it's probably not developed until you're 25. A couple of years ago, I saw a study from Oxford in UK. Now the researchers say it's probably not developed until you're 30. Well, you could wonder, has something stopped that development? I have my theory. I think it is, poor food, strange behavior that we treat as a behavior problem and we don't understand the biochemistry, and now screens. This will definitely put the energy in the brain, in the reptilian brain, which is only for survival, fight, flight, freeze, sex, food. So now we have an overactive reptilian brain, and the brain only has a certain amount of energy. So if the reptilian brain gobbles up everything, it's not enough to develop this part of the brain. So I think that is a very, very scary and dangerous view. So this also leads us to, some people would think, I'm not going to go into that now, but I think a lot about how do we prevent this from happening? So that's another thing that I think about a lot.
yeah. So do you recommend that children should not have sugar or anything sweet till a
No,
certain age, like 2 or 5 or something?
I would say 5, 6 at least. And then, in restricted amounts. To flood a baby and toddler's brain with sugar and carbs is very, very dangerous. It hampers the development and it creates a havoc of symptoms, which we, in our society, with not enough knowledge and talk about this, make into diagnosis, which is very dangerous.
So does this addiction, do they have some some mental health implication? Like do they cause anxiety, depression.
That is one of the main keys, of course. If you look at this, these are diagnoses that clients came to me with and telling they have been to a psychologist, to a psychiatrist, to the healthcare. You see, it's both physical and psychological problems, mental health problems in this picture. It was an underlying addiction but the healthcare system, which they looked for help in, they had no idea what addiction was. They couldn't even spell the word addiction. So, of course, they put all these diagnoses on them with sometimes talk therapy, sometimes with medication, but nobody addressed the addiction. So this is a very scary scenario. I'm going to tell you one incident that happened to me many years ago. There was a psychiatrist here in the middle of Sweden, because what I've done in Sweden has been very controversial. I met a lot of resistance. And at one point, there was a journalist asking me, why do you keep working with this when you have so much resistance? And I said, because I'm right. Because I listened to those more than 6,000 clients telling me, help me, I can't stop eating, I'm killing myself. You know, they were desperate and they had lousy meetings at the doctors and the medical system. So my dream was always to train, and I used to say, I take all the doctors and nurses to a deserted island and I force them to learn this. I was joking with that. But anyway, this psychiatrist calls me one day and he's introduced himself and he said, you and I have a client in common. And he mentioned a client. And I said, yeah, we do. And he said to me very sternly, what have you done to her? And I got scared. I thought, God, have I done it? But, you know, I work with sobriety-based treatments. I thought, I can't have done something bad. And he said, she's gone to my place for many years, and I diagnosed her as a borderline. And as you know, it has the saying in that department that you can't treat or really help in borderline. And he said, she went to you for 4 years ago, and she's living your program now for 4 years. She came back to me for a follow-up visit. She doesn't have one symptom on borderline, so I'm very curious what you're doing. So I started telling him. But anyway, that was interesting. So the thing is that our brain is very, very sensitive for sugar, you know. So insulin resistance in the brain and malnutrition, and I like to add, you know that every neuron had a fatty acid profile. And if that is wrong, I used to, when I explain to people, the fatty acid is the packing in the cell, otherwise they would all fall together. And that's a keyhole. It's an important keyhole. The neurotransmitters, which we have about 70, it's not only about dopamine. People think it's only dopamine, but it's not. So anyway, you know, they are the keys. So even if you have lots of keys, you have a broken keyhole, it's not going to happen things here. So you're going to get a very serious imbalance. And as I told you, the reptilian brain, which is the survival part, will hog all the nutritions. And what's going to happen is that your limbic system doesn't get enough, the emotion center, your prefrontal cortex doesn't get enough of good fats and neurotransmitters, and then the cortex, God, I lost the name, you know, neocortex doesn't get enough. So you don't function properly. So you have a big faulty connection. It's actually hampered and disconnected. So you don't function properly. And we call that for short foggy brain. You get a foggy brain. But you see all these diagnoses. So the clients that have gone into treatment, I would point out, is take away every psychoactive substance. There is no other way around it. You have to go on a strict low-carb keto diet to heal. And it takes a long time to heal this faulty wired brain, to build up the nourishment. Then we have another problem, the microbiome. So, you know, when you eat these foods, they play havoc with your intestinal flora. So the problem is that now your capacity to make neurotransmitters, which you do in your intestines, is hampered. So you release too much neurotransmitters with the drug, with all the sugars and flours, and then your body cannot keep up and do more. So when the balance starts tilting, you're going to get craving for other drugs. That's why we today work with addiction interaction disorder, one illness, many outlets. So many of my clients have several outlets, most of them do. So what I advise the society and everyone interested in understanding these is to connect the dots between all the highly specialized disciplines. Sometimes I joke and say, that the kidney doctor doesn't know where the pancreas is and vice versa. That's a joke, but so we have to, because addiction is a confusing and complex illness in the brain that causes physical, psychological, social, and spiritual consequences. You lose the meaning with life. So we have to start connecting all the dots and, really look at the metabolic health. It's extremely important to restore that. Otherwise, you don't restore the others. We have to educate. So Professor Tim Noakes, he really had taken this message to his heart because a lot of doctors are nervous about this. But he says that food addiction, or sugar addiction, I would say, is probably one of the most important but unrecognized condition that contribute to human ill health. That's a very sharp statement. We need to learn addiction, because if you have a client that has multiple consequences, diabetes, obesity, inflammation, if there is an underlying addiction, you can try to treat all these things as much as you want. It's not going to work because the client will keep relapsing, keep relaxing. And of course, that's when doctors say to me, I don't want to work with addicts. They don't do what I tell them. No, of course they don't, because you don't address the addiction. If you treat the addiction first, then they will understand and do what you tell them. Okay.
What are
So
the changes you have seen?
pardon me?
What are the changes have you seen once you wean them off from sugar and
Well,
processed foods?
this part, the limbic system, the reptilian brain, which has taken over and become extremely overactive. So you could say, if you would make one little statement about what is addiction treatment, it is to calming this part down. Remember that the reptilian brain is only survival. It doesn't have a language. It doesn't learn from experiences. It's pure survival. And those systems in there, fight, flight, freeze, food, and sex, as you know, are instinct for us to survive. When they get overactive, you turn into any kind of addiction or behavior that will eventually kill you. And this brain is not smart. It may be street smart, but it isn't intelligent, as I say. So it's so far from the head, it doesn't even know there is a head. You see what I mean? It only wants you to survive. So we have to calm this down. And when we do that, I work with something called the biochemical repair. I start repairing the brain with food, number one. Take away the psychoactive substance, and then the correct food and sleep and breathing. Every addict overbreathes, and that causes another biochemical hazard in your body. And then we teach that, and we work on improving sleep, physical activity, and we use some supplements, like, supplements that can act as a crutch for all the neurotransmitter imbalance, like GABA, gamma aminobutyric acid, is an excellent one to start calming down, because that's what's going to give you the deep rest so that you start healing. And of course, we do a tremendous amount of behavioral changes. And I think that is the hard part. And, and I'm going to come to that. And then the biggest resistance we have in our society today is the shame, because clients think, what's wrong with me? How come she could do it and I couldn't, or he could do it and I can't? Why do I keep failing getting my illnesses in order? Because they will not share with their professionals how they relapse, how they start eating, how one bite can trigger 5 weeks of relapse when they get really sick, because they think it is willpower. It has nothing to do with willpower. So we have to teach them it's not your fault. It's a combination of a sensitive brain and a psychoactive substance. And then this happens. And then your brain is hijacked. And, you need help to get out of that, to calm everything down. And also, our society has a lot of stigma. A lot of this, too, is money, of course. Big companies that want you to go on diets, try strange diet pills, all that kind of thing is very dangerous in our society today. And then there is a third thing happening that is very important to understand, that these clients, they are victims of something called a biochemical denial, which is not the regular denial where you lie. I didn't eat ice cream. No way. And here, this denial is due to the hampered brain. As I told you, you're not fully connected. So you cannot see how behaviors and what you eat and what you do is actually keeping you in the sick loop. And you also have to remember that the mitochondria get very low. You don't have any mental horsepower anymore. So, when your doctor tells you, well, you need to start exercising, you need to eat this, you need to do this, they feel like you're telling them to step up Mount Everest, no oxygen, and a huge backpack. They don't have energy. So that is our biggest problem, and we need to understand that. Did you have a question or?
Yeah. So what I mean to ask is that means you recommend going cold turkey. That means if someone is addicted to sugar, just get off rather than reduce.
Yeah,
Correct?
absolutely, absolutely. I mean, I worked with addicts, alcoholics and all that. And of course, with those drugs, you have to do a detox schedule, and you might sometimes use subscription pills to counteract so you don't go into delirium or something. But that's no, you don't have to do that with this. But it can be very hard to go cold turkey. But I think it is worse to take it away slowly, because then every day you have to eat a little bit of the drug and a little bit of the drug. I wouldn't mind having that done if I had an in-house treatment where I could support them every day to slowly taper. But think about it, at home, you're working mom, you have people in the workplace, you have people around you that keep eating. So if you're going to try to moderate, what's going to happen is that you keep relapsing and relapsing. It's going to take a long time to get that band-aid off. So that's why I've done my trainings, my 4-day trainings, when I detox cold turkey. So after 4 days, they are in a different place and they can go home and keep going. So I like that.
So what benefits have you seen once you detox them away?
Well, first of all, they have withdrawal symptoms that I present with them. I give them a sheet to fill in so they understand this is withdrawal. I'm not going nuts or crazy. So this is the way it feels, and these crazy thoughts I have, and I have an impulse to eat or fight or shop or whatever, all kinds of things. But the important thing, which I really teach them, is because do you have a new self-help book? Do you have more studies? Is there a new pill? Is there a new method? They love to read about things like that, but they don't want to walk. So that's the whole society today. Something new, something new. But the thing that we have to do, which is the hardest part with these clients, they tell them we know enough. There is more than enough studies on sleep and physical activity and breathing and all that. We don't need so many more studies on that for you to start taking the first step, start walking. And the application of what we know to get clients to actually start. And there I lean back on the 12-step program, Alcoholics Anonymous, and those kind of programs that talk about baby steps, one day at a time. And I think many professionals can feel frustrated by that, but you have to do this whole biochemical repair, changing behavior, changing the thoughts, the feelings, the urges, the action in a very slow process. And it takes about at least almost up to 2 years to rewire and heal the brain and restore the energy. Because think about it, when you go into recovery here, we used to say, sure, it's easy. Everything you have to do is change everything. So it's not complex. I mean, it's not rocket science what you need to do, but it's not easy to keep doing this day after day. And that's why we work with first professional treatment where we teach them all this. And then on the side, they have support groups, and the support groups of like-minded, extremely important because you keep in touch with them every day about your progress on your little baby steps. I actually ate a good lunch today. I actually walked for 10 minutes today. I went to bed earlier. I did my breathing exercise for 5 minutes. We're talking baby steps. And also, they cry and say, how am I going to do this the rest of my life? Well, nobody knows what the rest of the life is today. So we are very, very keen on you have to think about it until tonight. So I used to ask them, do you think you could eat in this new way just until you go to bed tonight? And they all say, yeah, I can. Okay, do that. And, we don't worry about tomorrow. And the next day, we help them do another commitment. Can you do it for another 24 hours? And of course, in time, they will see the progress, the feelings. The foggy brain is starting to lift. The energy is coming back. They get mental horsepower. And then they see, oh, okay, I do it one more day, one more day. I still do it one more day, and I have almost 40 years recovery because I know that's the way to do it. So we dare to diagnose and we dare to do that. So on your question,
Yeah.
how shall we raise awareness? Well, one way I know is to do my training. I have a 1-year training for specialist, holistic medicine for addiction online, and I do certify in this diagnostic tool that I have developed in 2013 that gives the client the progression curve of the illness over their whole life and the weight curve and all the consequences. So from that, we do an individualized treatment plan. So anyone that listen now that might be interested to see what a powerful tool the sugar interview is, please email me and I give you a demo because it would take another 15, 20 minutes to do that, But I'm more than happy to show you because I say like Churchill, the further back you look, the further forward you can go. So most clients, when they get the results of that, start crying. But not because they're sad, they got the diagnosed addiction over relief. And they keep saying, I have felt that I'm an addict and behave like an addict, but nobody have believed me. People don't want to take me serious because everybody said, no, it's not that bad and so forth. But it is that bad. And another thing I like to introduce all of you to is the starfish thrower. I mean, if we look at both you and I probably look at huge amount of science and numbers today, and we see how incredible, huge amount of people that are sick. I mean, somebody said that in US there is only about 7 to 8% of the population that have a healthy metabolic change. That is scary. In Sweden, obesity has doubled in a few years. Child obesity is prevalent. Teenagers are on antidepressants for symptoms that I'm sure is caused by malnutrition brain a lot, which is not going to work, of course, unless they change behavior. It is a tremendous amount of energy drinks sold in Sweden every day. We see a lot of violence. And, Professor Lustig mentioned a study where you could show that soda in young men cause aggressive behavior. And of course, we understand that when we understand the brain. So this story I learned very, very long time ago in my training. It's a little girl walking on the Pacific beach, and there's thousands of starfish blown up on the beach, and she's throwing them back in the ocean one by one to save them. And then an older disillusioned man comes by and said, you can't save all these. So it's not going to make a difference. she picks up another one, throws it back and say, it's going to make a difference for this one. So, yeah, I encourage all of you to be a starfish thrower. Reach out your hand where you can, educate, teach people about this. It is worth a tremendous amount. And
Yeah,
also, yeah,
yeah,
we're almost
yeah.
done, right? Did you have a question?
Yeah. So Bitten, so we have around, less than, we have around 10 minutes before our comment comes in. So what I wanted to ask is first of all, what you recommend is cold turkey. And another is throw challenges so that, give them 1 week, give them 1 month, 1 week, one more days so that they overcome addiction. How, how would you respond to India's dietary pattern, which is high carb, very low protein, and also sugar based? Many of the festival events are all celebrated with sugar in various form, either direct sugar or the crude sugar, which you call as good or jaggery, or maybe coconut sugar or any other form of sugar. How would you respond to that?
Well, first of all, everybody has to learn that there are people that are normal users. They don't have the sensitivity in the brain to develop an addiction. And they usually eat very little of these things. They don't get craving when they eat. They could have a piece of chocolate, some ice cream, even a drink, and then they are satisfied. They have no urge because their biochemistry is like a flat line. They're normal. Those exist. I tell you what. You might not think so, but yeah, they do. And then you have a big group called harmful users. They are the emotional eaters, the stress eaters, the cultural eaters, the party eaters, not having any knowledge eaters. They don't know actually. And they do develop, they can have diabetes, they can have obesity, inflammation, they can have a lot of consequences from not really knowing. Those people, we have to ask them, why do you eat like that? And then they eat in moderation. We could improve their nourishment intake, their lifestyle, coping strategies, anti-stress, work with thoughts and feelings. I mean, there are many things we could do where they could go down to a moderation eating and eat good food in between. And then we have the addicts. So, as a practitioner, you have to understand those three levels. So, when you change a country, you can't, the whole country can't go keto. We know that, you and I. Sometimes we wish, but my thing first is to help people understand those through levels. And then, but if there is an addict, also to prevent addiction, think about it. It's a genetic predisposition that makes you react to a psychoactive substance. What do we do? Well, we have to teach people, and we have to also, primary prevention is to see that we prevent a problem from ever happening. So anyone that have these problems and the consequences, we have to teach their families. And I think that we have to, every government should absolutely not be in the knee of the food industry. They should start developing healthy practices that improves the health of everybody, because that's going to improve the energy, that's going to improve everything in the country if you feed our beautiful body the right nourishment. But it's a huge task, a huge task. But I think schools could be educated, and any place, workplace. And also I think that people should be encouraged to be role models and help developing better habits, and also stand for that in front of others, no matter how much pressure they put on them. Because still people can ask me, I mean, I've done this with alcohol for 40 years and sugar and flour for 32 years, and still some people that haven't, that not the people, my family or people that know me, they can ask me, when are you going to start eating normal? And I said, what's normal? I'm eating normal. You're not. That's my standard answer. So that, and the challenge will be, and that's what I developed the program for. If you are, let's say most clients that come to me are women. Their hobbies are sick. I promise you, it's a very, very equal illness. But men have a harder time admitting that they have lost control over cookies and ice cream. But the women also stands for the cooking in the family. So we have special groups where we support them to stick to their regime, no matter what, the family says. Because in the beginning, the family, the teenage kids, maybe other kids, are terrified. Do you mean I have to eat like you? This boring food plan? And then we have to support them to stick to their food plan. Otherwise, they're going to eat themselves to death. So we train them to ask the family, I don't demand that you change your eating, but I want you to support and respect me doing this for my health. And then, of course, you share this in the support group and you get ideas and tips from what other people that have done this before you will tell you how to stick to it. And that's why we do this 1 day commitment in the morning. No matter what happens today, I'm going to stick to my food plan. No matter what happens today, I'm going to stick to it. We also have to be aware that this takes time. It takes a long time, to go into recovery, as we call it. It takes years. And it has to be a professional, tailored, plan how to help people with this parallel. So I really advise you to understand that. But, this is my favorite picture. It's in Philadelphia. To me, I got this from my mentor many, many years ago. This is an addict because the drug is deciding who you are and what you do and how you feel. You are absolutely locked in. An addiction comes from Latin enslaved. And the treatment that we work on, the holistic treatment, helps this person. We don't fix them. We give them the tools to heal. So this is what they start doing, breaking loose until you're free. I just love this picture. I think it says it all.
Thank you. Very, very nice picture and photograph. And I recall seeing all these in Nutrition Network during your training, which you used to give. So do you think low carbohydrate and ketogenic diet would be an effective way to
I know it. I know it is. And also I know that in the low carb, which I started using 2005, there's a lot of dairy products and I exclude butter and ghee. But we know today that casein and whey in milk products like whipped cream and yogurt and all that will actually trigger many of these clients to increase insulin and cause cravings, which is a big painful thing that we help them deal with, craving management. So we exclude that. And then you're down to keto, and animal protein, good fats like coconut oil, or olive oil, butter, ghee, MCT oil. Those are the things that we use, the only fats we use. And then, of course, some veggies grown above ground, but we also consider oxalates for some clients that we think, could have that problem, and the anti-nutrients. So, of course, it is like a plain food plan, but we have to help each client to find their own fuel mix between the protein, the fat, and the veggies. And some people go on carnivore when they need to lower the craving, and it works beautiful to just, cut all the carbs out and reset their body on a carnivore diet.
So I think, getting off dairy, I had put this question to you also earlier. In India, it is very difficult because primarily we are all dairy vegetarians. It would be a little tricky for us because we need to source protein. And if people are vegetarian, then dairy is the source. Probably something like paneer or cheese or yogurt and butter, ghee, of course, we do use. So
it's the same over in Sweden with the dairy products. But I'm very, very upfront with my clients. So if I see that they can't handle those dairy products because weight stall, continuous inflammation, severe cravings, relapses, I tell them, I have to be honest with you. I would do you a disservice otherwise. And also, I compare it with peanut allergy. If you have a peanut allergy, we have to take it away no matter what.
And thank you. Thank you, Bitten. And thank you very much for enlightening session. I know this is a very complex an interesting topic, and we can talk about this for 8 hours because it is such a vast topic. But however, the session comes to end since Ivor is here. So once again, on behalf of Metabolic Health Conference and on behalf of D Life, on behalf of me and Anup, I thank you very much for coming in this session and sharing your knowledge. Anup, can you get Anup in just for Anup, so that you can thank Bitten. Bitten, you can stop sharing this so we can see
Oh,
Anup.
good. Okay.
Yeah,
Anup,
thank you.
get
Thank you
Anup
very
in.
much. Thank you very much, Bitten. It was an enlightening session. Before we just wind off, just a quick question. Are fruits addictive?
Fruits, no, not fruits, but the sugar in fruits.
Yeah, that's okay. That's what
Yeah.
I wanted to
So,
hear.
yeah.
Yeah.
So most of my clients, in order to curb their sugar craving for cookies and cakes and all kinds of junk they've been eating, they think fruit is healthy. So they eat a tremendous amount of fruit, and they get a candida in the intestine, and the candida causes havoc in the intestine. And that's a long lecture, but that causes more cravings. And so, and also we have them try, glucose meters and take an apple as a snack and look at the blood sugar. And most people get shocked when they see what's going to happen.
Thank you.
So
Thank you.
some people
Thank
can
you.
eat berries, but not fruit. I take away fruit. Yeah.
Thank you. Thank you. Please get in Ivor Cummins and Mandar. Thank you very much again, Bitten. I'll see you again. Bitten is my guru. Thank you. I'll see you again.
Thank you. Mandar, is it okay for me to use that saying about the GPS?
Oh, absolutely. Yeah,
I
yeah.
quote you. I want to quote you in my book.
Absolutely. Thank you so much. My honor. Thank you.
Thank you. Any more? Oh, Ivor Cummins, one of my heroes. Are you rocking around?